Flores. Good morning. It's 8:12. Let's go back into the KUAM News Zoom room where our sanitizing duendes have cleaned everything up for our next guest. He's been coming on since it was containing COVID, and we're so glad he jumped on the link with us many times. Dr. Peter Lombard, who, as you can see, will be sharing some graphs and some data. He's kind of made I don't even know if hobby's the word for it anymore, Doc. It's become almost a pastime with you, crunching the COVID numbers. Good morning.
Good morning. How you guys doing?
Pretty good. And so we wanted to get you on after Public Health. I guess was first. What were some of the takeaways of that interview we had with Public Health? Did they tell you anything that you didn't already know?
Well, you could feel her frustration. It was very palpable, and every time she comes on, I think you can feel that. And she's not wrong. I think sometimes the message is not going to be heard by the people that you want to hear it the most, though. And that's kind of the problem. How do you reach those people? Because again, I think that the majority of people are doing the right thing. There's just some people not doing things correctly, but there are some small little messages that could get out that probably would help things. But what I found really encouraging was the fact that they're getting more bodies and they're looking at more data, and that's wonderful. I mean, it's kind of late in the game, but especially something that's going to be lasting as long as this is, better late than never. The more bodies in public health can only help over there.
Doc, so I know you got some charts here. Tell us what we're looking at. Do you want to we'll give you the floor, you jump into what you have to share with us this morning.
Yeah. Well, Dr. Bobutsky had a lot of, she says, more people, more bad news is, show them what's actually happening out there. This is a little bit of that with a tinge of goodness on it. But this is an overlay of all the U.S. states with all the countries in the world. And it shows what their 7-day average is for new cases in a day, normalized by population. So you can see, Guam is up there right now. We're maybe around number 10. And that's, if you treated all states like countries, that'd be around number 10 in the world in terms of how many cases are being testing positive every day. And we're kind of sitting at this 50 cases per 100,000 people. If you look on the left side of the screen, that's where we've been for the past couple weeks. And we even seem to have peaked and plateaued a little bit and coming down. And that's a very good news. And it's pretty astounding to see, even a week ago, we were probably 6th or 7th in the world in terms of this rate. But some other countries you see, especially in Europe, are rapidly increasing. And it's really amazing that you look at Czech Republic and Belgium, they're over twice as many cases per day per capita as where we are right now. It's just astounding that they're being hit so hard right now. Something interesting about this 50 cases per 100,000 mark. I mean, there's not many times in the history of the pandemic so far this year that many countries have exceeded that. And this is really the first time we're seeing as many countries as this going past that. And look at North Carolina and South Carolina, they're just barely behind Czech Republic and Belgium up there. So it's, for context to see how we're doing compared to the rest of the world. Unfortunately, we're not the same. We're a smaller country, but I think you can see that we don't compare very favorably when it comes to how we're performing. This next slide, this is a graphical representation of what I've been trying to predict based on the cases we're getting every week or two, and trying to say, okay, if it takes 2 to 3 weeks for a death to show up, how many might we predict a couple weeks from now? So you can see in the actual deaths here is in the orange, and the blue is what the calculation has come out has predicted. And so it's been fairly accurate. I think I mentioned the actual deaths are outpacing, at least last week, are outpacing the calculated by about 4 or 5, but it's still fairly close. And remarkably, it's been a fairly linear progression since about mid-August when our second wave started to increase. If we increase at the same linear rate, which would really assume that we have the same number of cases per day and within the same distribution of ages, then you can see if you extrapolate out towards the end of the year, we'll be at somewhere around 150 deaths, and that's just the reality. I think that's kind of what Dr. Bobutsky was referring to. This is where we're at. If the cases get skewed more towards the older ages, then we're going to see more deaths than the line here. If we get more cases than 80 per day, we're going to see more deaths than the linear line here. But we had a couple, the last couple weeks, there was a higher percentage of people over 60. There was a few in their 80s and 90s, and those numbers matter when it comes to the prediction. So you can see it in the dark blue line there kind of goes up above. Yeah. And that calculation is really based on, again, how many patients are in their 90s, 80s, 70s, and 60s that are positive, and because the expected deaths within each of those age groups is different. So it actually, the prediction line here actually takes that into account. So she also mentioned this excess deaths things. I don't know, I'm sure they're doing some work on this as well too, but I looked up the data for the number of deaths in Guam for the past number of years, and you can see in 2019, about 878 deaths over the course of the year. If you take 2020 and you take the first 10 months through October and you average the number of deaths per month and you use that average for the next 2 months, November and December, this is what's predicted. So you're looking at 1,050 deaths over into 2020, and that's about 170 deaths over the 2019 number. So if the previous slide showed about 150 deaths are expected, and this is showing that we're going to have about 170 deaths, then there's a few deaths there that are unaccounted for. And there's two reasons for that. One is we're undercounting the actual COVID deaths. I know there's been lots of discussions, people thinking we're overcounting them because we're calling some deaths COVID deaths that aren't true COVID deaths, but then there's also arguments that we're undercounting them. There are people that have died that maybe are COVID deaths and we don't realize it. Yeah. So the other explanation is that these excess deaths are being caused by lockdown measures. And that's, we had a discussion a couple months ago about the suicides, and if that rate is increased, we have more suicides in this year compared to previously. That can help to explain this excess deaths amount. There's some countries that actually showing excess deaths are less than previous years, and we think that's because there's less deaths from other communicable diseases. I think we've discussed, other folks have discussed the fact that in the Southern Hemisphere, the flu season was practically non-existent in the Southern Hemisphere, and they've just gotten through their winter months. And I think most of the early indicators are showing that the Northern Hemisphere is going to be the same. Sure, there are going to be some cases, but compared to a normal year, I think the number of comorbidities and deaths from influenza, for example, are going to be much less. That's going to drive the total deaths down, and that's why in some countries that have a fairly good handle on their COVID situation, they actually have less deaths than expected. So that it makes the picture a lot more confusing. But I thought it'd be nice to at least show what's happening in Guam, and I think this is going to be a fairly accurate representation of where we're going to be by the end of the year. Right. More people are dying in Guam than in previous years, and I don't think there's many deniers out there. But
I know of one that tried to present this data and came to some harebrained conclusion that it totally conflicts with what you're presenting, and I would probably go with the doctor over a senatorial candidate.
Well, I'd love to chat with whoever that was and just see where they're coming from. A lot of times people are well-meaning, and we're all doing our own back-of-the-napkin calculations, and sometimes with good intentions we're making some errors in the way we're
this is a COVID denier. So anyway, but Doc, so given I'm looking at your chart there. Oh, never mind. That's cool. Let's go on to 7 day. Given the previous estimation of about 150 COVID infection deaths, this indicates either we are, 1, undercounting true deaths from COVID, or 2, COVID is causing deaths that aren't directly attributed to infections. So which of those do you believe is true?
I think it's probably more. I'm guessing it's a little bit of both, but probably more undercounting. Right. I don't see any data yet that suggests that lockdown measures yet have caused a lot of death, but I think that we're undercounting. That number 2 actually should be 2A and 2B. 2A are the deaths that are being caused because people aren't going to get their regular health care, for example. Right. 2B is that the lockdown measures and that's what's actually causing the deaths because of mental health illness and other things. So But I think it's probably a mix of both. I suspect that we're probably undercounting. There's some people that are dying of COVID, actual infection that we're not detecting.
Yeah.
Which seems remarkable, but it's that's what we're seeing in other countries as well too.
Right. Do you think us not having a permanent medical examiner has any bearing on deaths, COVID deaths or non-COVID deaths being reported?
I certainly that would help. Yeah, I would think that would help us sort that out. But practically speaking, I'm not sure how relevant it's going to be.
See. Okay.
Just it's interesting to see the data and it helps to provide some context, right?
Okay. 7-day rolling new daily cases and case
so
positive rate.
this is a representation of So the blue line there is the positive tests that we've had. And you can see the second wave kind of hit and peaked towards the end of August, and then the hospitalizations in that wave peaked around the middle of September. So it was almost 2 to 3 weeks later that the hospitalizations peaked. Now, if you believe, which I think is true, that we're peaking now with this sort of third wave in cases, that when we're plateauing, then expect hospitalizations to continue rising. Now, how high? That's a good question. You can see the proportion, how high this hospitalization number was compared to the test. It's already higher than you might expect if things follow the last curve. But I would expect at least for another week that hospitalizations will continue to rise, and maybe even longer than that. So again, just some context and trying to figure out what we might expect over the next few weeks. So I think what they're doing and bolstering the GMH capabilities, even if it's just a matter of tenths, that's a good thing. And I'd also would venture to say, what's going to happen to the cases? Are we going to plateau and just stay at this level for a long time? That's possible. My personal belief is that it's probably going to start to trickle down slowly, and after that, the hospitalizations will trickle down. So if they just have to withstand a surge for the next week or two, perhaps with tents, it's going to be adequate, and with the extra bodies that they have. Any questions about that?
No, keep on. No.
Because you can see, at least for the past, almost 2 months now, our mobilization has been about stable. So despite any changes in the PCOR 1 restrictions loosening or tightening, there hasn't been a great deal of change in terms of people's behavior out there, and that I think that actually bodes well, because although we haven't really made any changes to our behaviors, the numbers are stabilizing, and that's important, because remember the first graph where you saw some countries just skyrocketing even after they passed the 50 per 100,000 mark, the CR is already leveling off is good. And by the way, another reason why I think that's the case is because of how many people in Guam have been infected so far. I think I've mentioned that before, but I think we're probably at the 26 to 27% mark based on some estimations. And just to show you again the age distribution, the yellow down here is 60, and below that is over 60, so 70, 80, and 90. And the relative percentage over the past couple weeks did go up a little bit, and that's why I think the deaths over the next couple weeks will increase a little bit relative to the linear line. And lastly, I know there's been a lot of discussion about the testing and what gets paid for. So it's been kind of a livid discussion amongst the providers about the governor's comments, and whether they were made off the cuff, and she probably didn't intend to cause such a kerfuffle, but the actuality is it's very complex, and I try to actually put down all the different scenarios.
What a classy way to put it, Doc. Gov, you caused a kerfuffle.
You not have to pay, and to sort of off the cuff just say it's actually complex, and I think it would take this level of granularity before you could know for sure if we're based on the clinic you're going to, the symptoms you have, whether or not you have insurance. All those things matter in terms of whether or not you should have to expect to pay for your testing or not.
Can you give Jason?
And that's all I have.
Yeah, can you give him your graphs, or did you already get them? Maybe we can share them in your presentation. I don't know how that works technologically, but Doc, closing comments here before we move on to our.
Good?
Yeah, we're good. Thank you so much for all the data, the presentation, Doc.
I think I lost you.
Can you hear us? How about now?
Yeah, I got you now.
Okay, so just in closing,
Yep.
Doc, what do you want to say to the audience?
Can you hear me?
Yeah.
Yes.
Yeah.
Well, I think we know a lot of the transmissions coming in from the home situation and family gatherings. So, I think thinking about what you're doing when you're with your family is important. I think mask use is great outside if people did it inside their homes as well. Of course, that's not practical. But just thinking about that concept of how close are you physically to your loved ones in your house, especially if they're extended family that you don't see and live with all the time. Maintaining a reasonable distance, not getting up close to kiss them, on the cheek, not hugging them. These are little changes that may make a difference, even when we are getting together, which we probably shouldn't be doing. But if you are, at least try to make some small behavior modifications that will decrease transmission while you're with your family and in those gatherings.
I actually had that conversation
it's
last.
easy to say don't gather, but yeah.
Was actually talking last night of trying to remember the last time I kissed someone on the cheek. Because that's our traditional greeting. It's like, oh, hey.
Yeah.
Yeah. Thank you, Doc. Appreciate it.
Yeah. And those are the little details that'll help. But yeah, thanks for having me on. And you
Always.
guys have a great Friday.
Thank
You
you.
too.
Have a good weekend. Be safe. There's virtual shrimp patty. You don't really look like a shrimp patty kind of guy, though. It's vegan. Air fried? Do you have any air fried shrimp patty?
No, I think Dr. Lombard would get down with some
I
shrimp
can
patties.
use a nice hot pizza.
He wants hot taquitos. Yeah. He's like, you should have come on yesterday.
Oh, man.
Okay. There you go. There you go. Okay. You take two then, Doc, okay?
Thanks, Doc.
We should get the data from Doc. How many miles do you have to bike to burn off a shrimp patty? I bet he's got a chart on that. All right, guys. Thank you. It's 8:29. Quick break, and then we're going to just get right back into it with Dr. Michael from the Physicians Advisory Group next on the link. Good morning, Guam.
Up to you.